don't think there's enough research. We just know we're seeing more and more that there are more women with ADHD or a diagnosis of autism who are also the ones who are struggling with the severe premenstrual symptoms. And I think, well, for example, with ADHD, then there's often a heightened sensitivity, and we see this in autism as well. You're hyper aware of things, you know, with the ADHD brain, which is incredibly busy, and you can never control things. That can go kind of haywire during the premenstrual phase, and already there's a heightened sensitivity to the, you're easily distracted, that kind of thing. It's just I feel that people with who have a neurodivergent brain, they're already kind of highly sensitized to their environments, and PMDD is another form of sensitization. The way I see it, you're incredibly sensitive to those hormonal swings. So sometimes I will say in clinic, it's a bit like if you're thinking about the volume on a radio. So women without the neurodivergent brain, without PMDD, the volume on their signals from their body will go up and change with the menstrual cycle. So maybe in the follicular phase, it's like a background low level 2. Maybe it goes up to 3 or 4 during the premenstrual phase. When you're living with ADHD or autism, you're probably so much more aware, maybe not consciously, but you are more stimulated by your environment. And so your volume is up at, say, 7 or 8 anyway. When it gets to the premenstrual time, it's 10 plus. So, and I suppose the way you want to manage, treatment is kind of turning down the volume on the brain and giving the signal back to the body and mind. You don't need to overreact. This isn't an alarm. It's not an emergency, because I don't know. This isn't a very scientific explanation. It's just the way I kind of describe it. Because there's also a link with connective tissue disorders like Ehlers-Danlos syndrome and hypermobility as well. And then again, with Ehlers-Danlos syndrome, there's associations with anxiety and neurodiversity. So these often come together. You'll see women living with hypermobility, anxiety, ADHD, and PMDD. But I think it's the body is in a sensitized, and the mind are in a sensitized state, and it's luck of the draw really with genetics, but environment play a part as well.